Xin kính chào quý vị. Mời quý vị đến với chương trình của AAS Today. Và đặc biệt hôm nay Kiều Thu hân hạnh được tiếp chuyện với bà Kay Corey, là delegate của District 38, tức là thuộc vùng Annandale và Falls Church. It's my honor to have you here today with us, and thank you for coming and to share with us some view about our community. And welcome to the studio of SBT and DC.
Thank you. It is my honor to be here, and I really appreciate your taking the time to talk to me about these important issues. I have represented the 38th District, which is Annandale and Falls Church, now since 2009 in the State General Assembly, but before that for 10 years on the Fairfax County School Board. So this is a community that is dear to my heart.
Right.
And I know the needs and the growing numbers in your population, and how important it is for us on the state level to recognize this community.
I'm sure people in the 38th district recognize you. We have a chance to meet when during the election season.
Yes.
At AA Success, the
Yes.
office. And I understand that right now you serve on the health committee.
Yes, I am very fortunate. I am on the Joint Commission on Health Care, and that is both for the Senate and the House of Delegates. Our mission is to review the healthcare system in Virginia and make recommendations for reform and upgrading. It is a rather large mission. We meet a couple of times a month in Richmond, and at our last meeting we actually heard a presentation from NIH about hepatitis C and hepatitis B, and most people don't know how serious the prevalence of that disease is, and also how it is a latent disease, that a silent disease, that for a number of years people who have that disease feel fine, and then they develop liver problems in their later years.
It's a long-term damage.
Yes,
process,
long-term
but we don't realize
damage.
that.
Exactly, that does not really affect you until, frankly, it's too late to do much about it. And I know that unfortunately it affects the Asian American community disproportionately to the rest of the population.
That's right. People talk about hepatitis and vaccine, but in your study, you find that there are big differences, or the ratio of the Asian population get hepatitis is higher
Yes.
than other races?
Yes, it's almost 1 in 10 Asian American senior citizens do have that disease. That doesn't mean that they have acute liver issues, but it does mean that they need to be tested and monitored. Fortunately, there are some new tests available that are not nearly as expensive as the old testing used to be. Exactly. And there are increasingly numbers of vaccines and management medications that are available for people who have been identified as having an acute liver problem because of hepatitis B or C. Apparently, the fact that the reason that it affects so many older people, senior citizens, is because 40 years ago, when people might have gotten this disease and have been treated for it, then most doctors and patients thought that was the end of the necessary treatment and or evaluation, but that's not true. Now we know that you need to be screened periodically and followed, and at some point you might need regular medication.
At this time, you encourage people have to go testing, check things out, but are there any symptoms that the people should look out for?
The first part of your question, my answer is yes. as a patient, especially older Asian Americans, you must ask your doctor to test you for hepatitis B or C. Many doctors are not including that screening, that test, in their regular physical examinations. Not because, not purposefully, but just because it's new. So you do need to ask and be sure that on your regular annual checkup, you receive that screening.
I see.
And symptoms really are very difficult to isolate.
Okay, thank you so much.